Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hello, I'm Dr. Warren, and today we want to talk about the difference between chronic Lyme disease and an autoimmune disease like lupus. And this is very important because one of the biggest differential diagnoses we have when someone has chronic pain, when we're looking at the possibility of Lyme disease, we often get sent to the rheumatologist because doctors think this looks like an autoimmune disease, with lupus being one of the more popular choices. And because this can get confusing and there's actually opposite things you do in each condition, it's very important to determine if it's really coming from something like lupus or if your symptoms are coming for something like Lyme disease. Let's jump in. So just to start by clarifying, lupus is an autoimmune disease where your immune system is aberrantly attacking parts of your own body. Now, in Lyme disease, we have a bacteria that the immune system is reacting to, and we get symptoms directly from the Lyme bacteria and symptoms from the immune system creating inflammation, trying to fight the bug. Now, on the surface, when you're going to the doctor, these things can look quite similar. For many patients, you end up with headaches, joint pain, muscle pain, difficulty after a workout. And so you get this chronic inflammation and this pain that can lead to sleep problems, that can lead to neurological problems, and they can look very similar on the surface. Now, there are different rashes. In general, lupus specifically has kind of a malar rash or a butterfly rash, and that can help distinguish if you have that specific rash. Also, Lyme disease has the bullseye rash. If you have those, it can help you distinguish, but many people get these manifestations without those rashes, and so once again, it can look quite similar on the surface. Now, when we're testing, there are very, very different tests for Lyme disease versus lupus. So when we go into the doctor, the standard tests for lupus are what's called a SED rate and a C-reactive protein. These are your classic inflammation marks. Now, while both are often high in inflammatory conditions such as rheumatoid arthritis, lupus is distinct in that we often find the C-reactive protein normal and the SED rate is elevated. These are two classic inflammation markers. I always joke with patients that the C-reactive protein is the newer of the two tests. We did invent it in 1930. So it's always funny to call a test that's 95 years old the new test. And there's so much more advanced immune system testing that we can be doing on tricky patients and people who are chronically ill that's in the research, but still not commonly done at regular doctors. We do some of this in our test in our office on many patients, and I'll talk about some of that today. So in lupus, we generally have an elevated SED rate or ESR with a normal C-reactive protein. We then run what's called an ANA, and that, if it's positive, we can run further follow-up tests because that's positive in a myriad of different autoimmune disorders. And then the slam dunk that it's lupus, there is a dsDNA test or a double-stranded DNA test. When that's positive, that kind of confirms absolutely that this is lupus. Now, the problem we run into is that has a very rigid testing pattern, and then Lyme disease has a common pattern where we'll run one species of Lyme called Borrelia burgdorferi, and then if that immunoassay is positive, they'll run a follow-up, what's called a Western blot. Now, we have other articles on how bad this testing protocol is. It's from the mid-90s. We now, in our office, do a much more thorough version of this test, and I badly think these need to be updated. So we run 18 species of Borrelia or Lyme, not just one at this point. We run multiple co-infections because most chronic people have co-infections. So instead of one test for Babesia, we run 10. Instead of 0 tests for Bartonella, we run 12. And so it's just a much more thorough panel when we are suspicious of tick-borne illness. And if your doctor's still running the test from the mid-90s, you're just way out of date, and you're going to have lots and lots and lots of misses in that scenario. So one of the most important things I'm looking for in history when I have a patient come to me is, have they been to normal doctor? The average Lyme patient's seen 8 to 10 other doctors before I see them. And so oftentimes I have these lupus differential tests either from the general practitioner or they've often seen rheumatology, because when you have chronic pain, one of the very common referrals is rheumatology. The two doctors Lyme patients get to the most are neurology and rheumatology. The rheumatologist can't find anything. Sometimes you get into chronic pain doctors. The neurologist can't find anything. Sometimes we get into psychiatrists. They just can't find anything. They assume it's all in your head. And this is hard for people who have trouble and have symptoms and have a lot of pain and just having a lot of trouble living their life. Now, as we look at specifics, the differences between Lyme and lupus, as I started my career, I thought these were going to be very similar, and I could not have been more wrong. At the beginning of my career, I thought I was going to do all autoimmune disease all the time. I was studying the difference between immune dysregulation and autoimmune disease. We were looking at rheumatoid arthritis. We were looking at lupus. And what you find through research is you find that the part of the immune system that really becomes dysfunctional in autoimmune diseases is, in general, you have a low-functioning T regulator cell. And we're going to get a little nerdy here, but it's important because in the details here, you'll find that lupus and Lyme disease have very distinct pathophysiologies and very distinct immune system patterns. So when we deal with autoimmune disease in general, and specifically lupus, we deal with, in general, under-functioning T regulator cells. I call these the moms of the immune system. We want to, in general, boost T regulator function because it helps everyone else in the immune system behave properly. It's generally a good idea to try to boost T regulator cell function in people who have autoimmune disease, lupus absolutely included. You also get overactive Th17 and often Th1 sides of the immune system. These are a lot of your killing cells. So in autoimmune disease, you have a lack of immune regulation and you have an overactivity of the immune destroying cells, and they're just kind of destroying things willy-nilly. This is the problem with autoimmunity, is you are destroying your own body. And in general, we're trying to regain control of an out-of-control immune system. Now, as we get into Lyme and testing the immune system of people who have chronic Lyme, we most often find a completely different pattern. So whereas in lupus autoimmunity, we have this overabundance of Th17, Th1 activity, in Lyme disease in general, we have a depression of Th17 activity. We often have normal T regulator cell function, and we have lots of dysfunction in what's called the natural killer cells. Now, if you've never heard any of these terms, I apologize. Your white blood cells are your immune system. They are the part of your body that helps fight and maintain homeostasis against all these different bugs. And then you have parts of your immune system called granulocytes. You have parts called lymphocytes. There's T cells and B cells. There's all these different types. What we're talking about is you have the white blood cells and you have lymphocytes. And studying lymphocytes can give us a big clue into what your immune system is stuck on, what your immune system is struggling to win against. And when you get into some of those details, you find the difference between lupus and Lyme disease is very, very distinct. And often in Lyme, you're dealing with an exhausted immune system that can't kill things. I tell people often in Lyme, we're dealing with an immune system that instead of having guns to go arrest people, we have fun noodles. And so it can make a lot of noise, can make a lot of inflammation, but it's not really good at getting rid of these bugs. In fact, your immune system's stuck. One of the studies right now being done on Lyme is being done at Montana State, where they're looking at how Lyme circumvents the immune system to establish a chronic infection. And this concept is very important because when we look at Lyme and the co-infections, they're all altering immune system activity and function. Lyme disease is known to throw off natural killer cell function. Bartonella aggressively interferes with this Th17 in oftentimes the opposite way that lupus does. Babesia is known to interfere with B cells. And so as we look at each Lyme patient and the co-infections that they have, we tend to get different patterns of immune dysfunction because Lyme and each of the co-infections starts to interfere with your immune system. And eventually enough pieces of your immune system are broken to where it doesn't work correctly. I tell people this is like having a 5-person group project and you have 2 people doing all the work and 3 people doing nothing, just riding along. And sometimes you have the three people actively thwarting the people who are trying to do the work. And so you end up with these really out of balance, wonky immune systems, but it can really vary by patient depending on which co-infections you have. This is why in our office, we want regular standard testing to look at the possibility of autoimmunity like rheumatoid arthritis, like lupus or mixed connective tissue disease. And then we want a very thorough Lyme panel and co-infection panel. And then in many cases, now I'm getting further testing, whether it's either inflammatory cytokine testing or advanced lymphocyte panels looking at T cells, B cells, T helper cells, T regulator cells, Th17 cells to try to understand, okay, what's the immune system doing? Where is it stuck? And how can I help it? If we're going to get into action steps, if you're dealing with autoimmunity and lupus, the T regulator cells typically become a main focus. And things that increase T regulator cells are often omega-3s and vitamin D, some of your classic beginner steps for helping any autoimmune inflammatory condition. You also find that T regulator cells are mainly housed in the gut. And this is why when we're dealing with autoimmune diseases like lupus and we're dealing with autoimmune diseases like rheumatoid arthritis, that the gut becomes a main focus. By helping improve leaky gut, by changing people's diet to a anti-inflammatory diet, you can reduce so much inflammation and you can boost T regulator cell function and you can really positively impact people with this autoimmune dysregulation. Now, it's not that that can't happen in Lyme disease, but we find different patterns of dysregulation, and so oftentimes you need different immune therapies. So in Lyme, we're usually doing a lot to try to boost the killer function. So we're doing things like echinacea or andrographis or a variety of trying to boost up an immune system that's kind of running out of power compared to in autoimmune disease, an immune system that is out of control and you're trying to pull back the reins and get it back under control. Think of like a horse-drawn carriage just going out of control and you're trying to calm it down versus something that's just sitting there and you're trying to get it going. So very different problems to be dealing with. Now, just to complicate matters, when you're dealing with Lyme and lupus, about 10% of people can have both. So we do have cases where someone has an autoimmune disease, such as Crohn's, such as lupus, such as rheumatoid arthritis, and then we get bit by a tick. And infections are known to enhance and exacerbate inflammatory conditions. So if you already have an autoimmune disease and then you get Lyme disease on top of it, it can drive that inflammation. And when you have two things going on at the same time, it's just a little bit more complicated to unravel. We need to be very careful as we try to help your immune system fight the bug because we want your immune system to fight the bug, but we don't want your immune system to further destroy you. When we deal with lupus in particular, you're very much trying to help save joints. You're very much trying to help save kidneys because these are the parts of your body that can be destroyed the most aggressively. And when they're destroyed, they're hard to repair. It's easier to prevent the destruction in the first place if you can than to just let it be destroyed and then try to fix it later. Not a good approach. But for the 10% of people who do have both markers, this is also where, doing advanced testing really comes in because I tell patients the more tests that I have, the better picture I have of the problem. I can avoid more potholes. I can avoid more hiccups. I don't have to guess as much, and I can do things with more predictability, which makes the healing process smoother as opposed to when people have all these negative reactions that we're trying to work around. So this is, again, where information just helps you make wise choices and helps you get from point A to point B in a smoother, calmer road. And that's more important the more complicated the situation goes. So if you're one of those that has autoimmune and Lyme, then this can be doubly as important. Now, the other thing that can happen is infections are known to trigger autoimmune disease. So it can happen in reverse too, where you get an infection and then post that infection, the immune system loses control and you end up with an autoimmune process. In order to figure out which one of those is happening or happened, a lot of times you have to go through someone's history. But it can be hard when you're trying to dig back years and years on people to go which came first. Some people it's very clear, some people it's not, but once you have both, you're just dealing with both. So as I wrap up here, it's important to remember that all inflammation is not equal and all chronic health problems are not equal, not the same. So as we deal with something like lupus and as we deal with something like Lyme, you are helping the immune system in both, but often it's different pieces in different parts. You are looking at healthy gut is helpful, but it's a huge player in autoimmune oftentimes, and it's a secondary domino in Lyme. Absolutely can affect cases, many times does affect cases. So the difference in what you're doing is very different because you do have two similar problems in that you end up with inflammation and immune system not working well, but the details are very different in these conditions. This is why in our office we think testing and an individual evaluation is so important, because each person has a different combination of issues, whether it's Lyme and co-infections, whether it's Lyme and autoimmunity, whether it's lupus, gut, chemicals. By taking a thorough history in our office, by running tests that are applicable to each individual, we can get a good complete picture of what your body's struggling with. And with that knowledge, we can make an individualized plan that works for you and your healing. I hope you found this information helpful.